Lately, Lindsay hasn't felt like herself. She has always been a really good student, but over the past couple of months, her grades have fallen pretty dramatically, and she has trouble concentrating. She's even failed a couple of tests, and she hasn't yet turned in a paper that was due last week. Lindsay may not realize it yet, but she's depressed.
Teens who are depressed may also show other warning signs or symptoms. They may have increased problems at school because of skipped classes, lack of interest or motivation, or poor concentration and low mental energy caused by depression. Some teens drop out altogether, expecting to fail because of their problems.
The WHO, the World Health Organization, describes the depression as a mental disorder characterized by sadness, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep or appetite, feelings of tiredness, and poor concentration.
Depression can be long-lasting or recurrent, substantially impairing an individual's ability to function at work or school or cope with daily life. At its most severe, depression can lead to suicide.
When mild, people can be treated without medicines, but when depression is moderate or severe, they may need medication and professional talking treatments.
Depression is a disorder that can be reliably diagnosed and treated by non-specialists as part of primary health care.
Specialist care is needed for a small proportion of individuals with complicated depression or those who do not respond to first-line treatments. It's important to mention that depression affects differently according to the age range. Children don't react to depression in the same way that teenagers do.
Depressed children usually have prolonged sad or restless moods and have difficulty with motivation at school. Additionally, children with depression often lose interest in activities they once enjoyed, exhibit low energy, and engage in crying spells. These symptoms can cause a child to withdraw emotionally and do poorly in academic tasks. Sometimes it might be difficult for adults to notice depressive symptoms in children because depressed children don't act out, but rather turn in.
Although depressed teenagers show the same symptoms, they tend to act in a self-destructive way, which means that they have physical complaints, feelings of inadequacy or excessive guilt, and they also present severe symptoms of self-mutilation, suicidal ideation and suicide attempts, and uncontrolled worry.
How does depression affect in the learning process? Depression can impair one's cognitive functioning. The disorder interferes with one's thought process, the ability to make decisions, and concentration. Depression changes the brain, which can slow the brain's functioning.
Depressed people frequently experience memory problems and have trouble remembering events or details. As a result, they may be unable to complete tasks that require both high motor and cognitive skills. Patients may appear confused, scatterbrained, overwhelmed, or become frustrated easily.
Even everyday tasks can be difficult for someone struggling with depression. These mental impairments are especially costly to children and students who are still attempting to learn crucial fundamental skills.
According to Kearney and Albano, depression may be the cause of school refusal behavior for some students. Common characteristics of depression in adolescents include depressed mood,
Lack of interest in activities,
irritability,
difficulty getting along with others,
rebellious or risk-taking behavior,
sleep difficulties,
fatigue or lethargy.
and difficulty concentrating or indecisiveness.
How can students be able to learn if they do not go to school?
Cognitive problems. Cognition involves the development of intellectual abilities, which affects the way a person thinks and processes information. An article on the New York State Office of Mental Health website titled "Dealing with Cognitive Dysfunction Associated with Psychiatric Disabilities" reports that adults and children who suffer from depression are likely to experience cognitive impairments, which can negatively affect learning.
Depression affects cognition in children by altering the child's attention, memory, and problem-solving skills. Also, children who experience depression might have trouble organizing and recalling information. This can cause a child to fall behind in school and get poor grades.
Learning checklist. Parents and teachers can help a child manage his depression symptoms and improve learning by creating a learning style checklist. According to the same article that was already mentioned, developing a learning style can help a person with depression manage day-to-day tasks much easier.
As an adaptive aid, the learning styles checklist should identify the best way a child learns by a way of self-report. Examples of appropriate responses to include on the list are: I understand better when I read slowly, or I am a visual learner.
Future teacher's duty. 3 tips for dealing with students who are depressed in the classroom.
Don't ignore the depressed student. It shows that you don't care and invites the students to give up, guaranteeing their failure. Draw them out in class discussion and do whatever it takes to stimulate their minds so that they don't learn to ignore you.
Let them know that you care, but without getting too personal. Help them to update any missing assignments or set up extra study time. Whether they accept your efforts or not all depends upon the severity of the depression. The fact that you have proven you care can make all the difference in the world.
Never give up on the student. It doesn't matter how long they haven't wanted to put any effort in your class. Students can tell when a teacher no longer believes in them and expects them to fail, and it only ends up making the situation worse than necessary.
Treatment. A variety of options are available to help a depressed child improve her mood and potential for learning. Treatment for depression might include talk therapy, medication, or a combination of both. Sometimes, therapists might recommend daily exercise, exposure to daylight, or better ways of eating.
A therapist might teach relaxation skills to help the student get a good night's sleep. All of these things can affect the brain's production of neurotransmitters. Cognitive therapy can help a child understand the source of her depression, learn strategies to cope, and change destructive thinking patterns. Interpersonal therapy helps a child create a more positive relationship with peers and family and improve social skills.
Additionally, medication might help stabilize a child's mood so she can think clearly, which makes it easier for him to learn.
What helps depression get better? Many people find that it helps to open up to parents or other adults they trust. Simply saying something like, I've been feeling really down lately and I think I'm depressed, can be a good way to begin the discussion.
If you think you might be depressed, ask your parents to arrange an appointment with a school therapist. If a parent or family member can't help, turn to your school counselor, school nurse, or a helpline to get help. Friends and people who care about you can support you in other ways, too.
They can listen and talk, showing that they understand what you are feeling.
They can remind you that things can get better and that they are there for you through the downs and ups.
They can help you to see the things that are already good about your life, even when it's hard for you to notice.
They can keep you company and do enjoyable or relaxing things with you.
And they can give you honest compliments and help you find things to love or smile about. To sum up, depression affects in learning process because you can't concentrate in what you're trying to learn, and also makes you feel too tired for study or just not interested in doing it.
It can also affect your self-esteem, your desires to live, your motivation for doing anything. Depression makes you think about suicide or you mustn't exist. You are just annoying everybody and feeling lonely. All these factors affect learning directly. But with the right help and support you can overpass depression and continue living and doing everything as a normal person, included studying.